The real riddle that we have to solve is this ability to, on very short notice, as we saw with Omicron, basically do 10 times as much testing, 100 times as much testing. Having technology that allows us to do this, I think, is a key part of the approach to this.
Welcome to 20-Minute Health Talk. Today, Dr. Dwayne Breining, Executive Director of Northwell Health Labs, explores how his work could lead to a breakthrough in COVID-19 testing nationwide. Dr. Breining's lab is not only working overtime to keep up with the exponential growth and demand for COVID tests, now his team is rolling out new tech that enables labs to dramatically expand capacity in the event of another variant, virus, or pandemic. Dr. Breining, thanks so much for joining us. There is a big issue with access for testing. At the policy level, decision makers have promised to expand testing sites, and there are plans to distribute 1 billion home tests. What is Northwell doing to increase access to testing?
Well, with the Omicron spread, Northwell immediately relaunched some of its drive-through testing sites and walk-up sites. Most of our places are by appointment. We have a new laboratory technology that we launched in the lab that allows people to do an easy nasal swab, and they can enter their information on their cell phone or smart device, which allows more rapid access, and it's easier to launch these kind of drive-through sites. So Northwell's supported that from the beginning and relaunched a lot of those across different geographic areas to allow more access to testing.
Yeah, I love this LabGold. So just give me a quick little description of LabGold, because it seems like with LabGold, you don't have to wait for somebody to call you. You can just find out on your smartphone what your results are.
Yeah, so about a year ago, we became aware of a trial test that was being done on a new testing system that basically allows people to swab themselves to enter their own information about the specimen and actually scan a pre-barcoded specimen collection device so that it could come into the lab and basically be ready to analyze on the machine. And we saw these machines are actually an adaptation of machines that are used in the agricultural industry, where they do a lot of genotyping of the food crops. Some of these places, I didn't know this until I became involved. They're doing over 1 million PCR tests a day at a very low cost. So the smart people at the Bill and Melinda Gates Foundation had the idea to try and adapt this machinery to do diagnostic testing. And they needed basically some clinical laboratories to help them gather patients to test this device and this testing pathway to see if it was going to be accurate enough to be launched in the clinical world. So we helped them out with this trial. That gave us the opportunity to send some of our laboratory scientists to the lab out in Iowa where they were doing this testing. We were very impressed and immediately made the decision to invest in getting this testing technology on board. And as that got underway, we made that decision independently of the Gates Foundation, but the Gates Foundation has actually helped us with some funding to help develop this for clinical testing.
Can you put a timeline on the rollout of LabGold at Northwell?
We were able to start doing some trial testing with our laboratory personnel by the summertime, and we've done quite a bit of that. Actually, Dr. Tyler Chang, who was, our lead scientist developing this stuff, is probably the most swabbed person on earth right now, because he would routinely, swab himself about 800 times to keep feeding this machine and do validation testing. And a lot of us in the laboratory participated with that. So we were able to jump out pretty quickly with our own lab employees and provide that testing as our pilot group. And once that matured, we started offering it to more of our employee personnel. And then with the Omicron crisis, we were able to start rolling this out. And we've done as many as, I think we've done 12,000 tests in a day on this machine. It's a bit of a stretch given some of the technology that's not fully cooked on this thing yet. But that is actually as much testing as we could do in the rest of the laboratory combined. And is really only about 1/10 of the eventual capacity of this machine. So we're very excited.
Yeah, I think when this was rolled out, and this was rolled out first to Northwell employees, was it surprising how many employees actually went and took that test and how quickly that all went?
Yeah, it's this one of the genius of this testing pathways. It marries this very robust and proven technology, high throughput analytical testing machinery on the back end with a very easy and easily scalable test sampling system. So we've got these little pre-barcoded swab-in tube devices. There's no chemicals in there. These things are very small. They're about as big as a pen cap, from a typical ink pen. And they can be deployed anywhere because there's no chemicals in them. There's no storage conditions that need to be met or anything like that. Once the sample is taken, there's no special transport conditions or anything that need to be met. And because it's self-sampled and self-accessioned by the person who's doing the testing, it is literally as easy as putting a couple of baskets of these swabs out in a public place with a QR code that people can scan with their iPhone or their Android phone. And then they scan the barcode on the tube, enter some information so that we have their identification, and then drop the tube off in a rack after they've done their own sampling. It takes about 5 seconds to do the sampling. To give you an idea, when we started rolling out very quickly testing for our workforce, which was a big concern with Omicron because it was spreading so quickly, in healthcare, you can have a loss of essential services if this infection spreads throughout your workforce. So we wanted to start testing right away. Within about 2 hours of putting one of these testing kiosks out in one of our buildings, we had about 1,000 of our employees come through and swab themselves. It is that easily deployable.
What do you think this will mean for the community and the general public once this was rolled out to the general public?
We did start rolling it out for some of our drive-through sites. It's been very successful. From a technological standpoint and a lab accuracy standpoint, we branded it internally as LabGold because it is gold standard PCR testing. It's as accurate as anything else we do in the lab, so it's fantastic. But one of the real challenges of COVID, and we still haven't quite met it yet, is the scalability of healthcare in general, but lab testing is what I'm involved in. And, in healthcare in the U.S. in general, we haven't generally had to scale from, going from your usual amount of business and patient care to all of a sudden having to do 10 times or 100 times as much. That scalability is the real challenge in deploying to meet the challenge of COVID. This technology allows us to do that when we, fully mature it. I mean, we're inventing some of the machines to do this as we're going along and doing the testing. So it's not quite mature technology yet. But once we get it there, and I think that'll be by the end of this year, that rapid expandability and rapid access to testing could really solve a lot of the problems with COVID.
So, Dr. Breining, when we're talking about, how much more testing is going to be done nationally and some of the barriers that face, how is what you're doing here at Northwell going to help the rest of the country when it comes to increasing testing?
Yeah, I think a lot of the laboratory industry is focusing on developing this type of flexibility and scalability of different testing platforms to do more testing. We're very excited about this platform, actually, because we think it could be a key component of solving that problem. As I mentioned, the real riddle that we have to solve is this ability to, on very short notice, as we saw with Omicron, basically do 10 times as much testing, 100 times as much testing. And that's not enough time to hire 100 times as many lab techs, if you could even find them. They don't really exist. So having technology that allows us to do this, I think, is a key part of the approach to this. And, what we're working on now is if we can get some of our clinical laboratory peers throughout the country, maybe in some sort of regional distribution, to adapt this type of technology. And we're talking to the government right now if they could perhaps provide some funding.